Hello from Becky and me. Welcome to the final programme of the week.
First tonight, our new Health Secretary may have only been in his post for a matter of days, but already he's planning a big shake-up in patient care.
Andrew Lansley says he wants to change the way after-hours care services are run, with GPs forming cooperatives and taking on the role rather than private firms.
The decision follows the death of David Gray from Cambridgeshire. He died last year when German doctor Daniel Ubani gave him 10 times the recommended dosage of diamorphine.
Well, Victoria Webb joins us now from Bildeston in Suffolk. Victoria, I suppose anyone watching this will just want to know one thing, and that is, how's it going to affect them?
Yes, well, people living here in Bildeston won't actually notice a change because they have the only surgery in Suffolk that didn't opt out of the out-of-hours service back in 2004. So instead of having a private firm taking over that service, their GPs have continued to go out to see patients overnight and during the weekends. Now, under Andrew Lansley's plans, what he intends to do is take away the responsibility from the primary care trusts and pass that back to the GPs everywhere. Now, from the doctors I've spoken to today, they say that that would require a lot of extra funding to provide more staff, and it would change the way they operate during the day dramatically.
Here at Mount Farm Surgery in Bury St Edmunds, they haven't provided out-of-hours care for 6 years. Like many others, they signed a contract opting out of the service. The thought of having to go back to a life on call isn't going down well with some GPs.
I think most GPs are very nervous about the idea of taking back doing it themselves, because we remember what it was like before and we remember how tired we used to get, and that was based on the sort of workload that we had then, and things have changed a lot over the last few years since the new contract came in.
Until a couple of months ago, this building was the head office of Take Care Now, the private company that was responsible for providing out-of-hours GP care for much of our region, but it came into a lot of criticism.
In February 2008, the company hit the headlines when retired engineer David Gray from Cambridgeshire was given 10 times the correct dose of diamorphine by German locum Dr Daniel Ubani. The new Health Secretary, Andrew Lansley, says it's time responsibility was handed back from primary care trusts to GPs.
In my part of Cambridgeshire, our GP out-of-hours service was provided by CamDoc, which is a GP cooperative. The bit which served the Cambridgeshire where Mr Gray lived was run by a private company. Now, frankly, I am determined that the GPs will have the say about the nature of the services provided.
It's disappointing that he wants to bring GPs back to be responsible for the out-of-hours care. By all means, involve us in it, and I think that's very important, but to actually bring back the responsibility onto GPs is a retrograde step. We're so busy in the day that it's just not going to be practical to take it on.
Bildeston Health Centre is the only surgery in Suffolk that's maintained responsibility for its out-of-hours service. Dr Mark Hainsworth says they have a very understanding community, but for it to be successful in other areas, there would need to be big changes to the daytime workload.
There is, of course, the small matter of the European Working Time Directive, which is going to put limits on the number of hours that are done. So this means that GPs are going to have to work with a much larger staff level than they used to. And of course, where there's a larger staff level, there would need to be considerable increase in funds to allow that to happen.
Under Andrew Lansley's plans, GPs would work in local groups and commission services or provide them by working in rotas through co-ops. In Northampton, the out-of-hours service is already run by local GPs instead of a private company.
When you speak to doctors on NENDOC or you are seen by doctors and nurses in NENDOC, they're people who are working in the area, have a commitment to the area, and are responding to the high quality standards that we have universally in Northamptonshire.
Back in Suffolk, the Primary Care Trust says it remains committed to working in partnership with Harmony, who've taken over from Take Care Now. Those who've had bad experiences in the past will be hoping any change is for the better. Victoria Webb, Anglia News.
Cambridge police have been criticised over plans to hand out so-called DIY drug kits to addicts when they're released from custody. The kits will include clean needles and advice showing people how to find the best veins.
The scheme's being launched next month in the hope it'll help slow the spread of HIV and hepatitis, but campaigners say the move is farcical. Serena Sandhu has more.
This is the controversial kit that officers hope will help drug users kick their addiction. At Parkside Station in Cambridge next month, 20 kits are due to be handed out to drug users released from custody as part of a week-long trial. Cambridgeshire Police hope it'll help keep communities safe and stop drug users dumping dirty needles in public places.
By offering these kits, we're reducing those cases of HIV and hepatitis within the community, and indeed spreading it to the wider community.
The harm reduction kit contains 3 clean needles, a box to dispose of dirty needles and a manual with health advice on injecting heroin, showing how to find the best vein to reduce the risk of contracting gangrene. But some campaigners have labelled the scheme a farce, saying it sanitises the use of Class A drugs. David Campbell-Bannerman, the UKIP MEP for the East of England, is calling for a royal commission to look into our drugs policy.
It seems crazy. What we really object to, there seems to be total confusion on drugs policy. You know, are we zero tolerance? Shouldn't we sort of crack down on drugs? You know, or are we just going to be handing out advice like this proposed police advice on how to use the drugs better?
The kits were developed by drug support group Ad Action, who are funded by Cambridgeshire County Council. In a statement, they said, "It prevents deaths and reduces the risk of the development of other serious health problems such as HIV and AIDS. It is often the first step a drug user takes on their long journey to recovery, with government statistics suggesting 3/4 of hard drug users fund their habit through crime. Police hope this could be the first step towards a safer community." Serena Sandhu, Anglia News.
An investigation is underway after a 12-year-old boy managed to vote at last week's general election.
Brandon Thorne from Thetford took a polling card he mistakenly received in the post to his local polling station. And despite wearing his school uniform at the time, Brandon said he was given a slip and allowed to vote, as Emma Baker now reports.
Brandon Thorne is no average schoolboy. Despite a current knee injury, he towers over his basketball hoop at a height of 6 foot 3 inches tall. But this 12-year-old now has a new claim to fame as one of the youngest people to vote in the country, all after he got a polling card in the post.
I just thought it was a mistake and left it at that. I thought it was absolutely ridiculous. He said to Brandon on the day of the voting that we were going across to vote. He said, "Well, I'm coming across to vote." I said, "But you can't vote." He said, "I'm coming across just to see what they say about it."
When Brandon first arrived at his local polling station just minutes from his family's home, he didn't really think he'd be able to get through the checks. But just a few minutes later, he walked out of those doors as one of the country's youngest voters. Brandon used his vote to back Conservative candidate Elizabeth Truss and was delighted when she won the seat. But his parents say more should have been done to stop the situation.
I think it's crazy they didn't ask him for any ID or anything.
I mean, being in a school uniform as well.
There will be some people watching this who will think, actually, it's really irresponsible of you guys to have let him vote.
I realise that, yes. But as I say, we didn't. If we'd seen him got his voting card, we would have stopped him. But they gave it to him while we were in the booth. And I think it's their responsibility that they shouldn't have let him vote.
No one was available from Breckland Council to talk to us today, but in a statement they said, if an individual votes knowing they are not entitled to, this is a criminal offence, and we are therefore referring the matter to the police. The council would like to stress that the action would not have had any effect on the outcome of the poll results. Brandon's parents say they clearly stated his age on the voting registration form. They now want more checks to be brought in to prevent more children voting in the future. Emma Baker, Anglia News, Thetford.
Well, I guess at least it's good that he's got an interest in politics, I suppose.
Yeah, absolutely. Yeah. And he highlighted a problem as well.